So welcome back to the anatomy lab for the case of the 47-year-old gymnast with arm pain, wrist drop, curled fingers, and a numb spot on the dorsum of his hand. So Alex, I think we'll start by just palpating the bony landmarks.
Okay.
So even though we can't see the structures beneath the skin, if we can palpate the bony landmarks, then we can identify where those things are. And we'll be locating the skin incision that we'll be making relative to these bony landmarks. And so we'll start at the shoulder. So we've already reviewed some of those landmarks when we did the shoulder case. So let's go back and find the olecranon process, which is here. And your olecranon process is here. And then right below that, right there, that will be the greater tubercle of the humerus, which we saw in the last case. And then as we come down, the humerus like this, Alex has powerful muscles all along here like this, and so we can't feel this humerus, but then, there we go. Then once we get down to here, here is the medial epicondyle and the lateral epicondyle of his humerus. And as you know, anytime there's a bump or a prominence, it's usually because a lot of muscles are attaching to it. And then there is the olecranon process of his elbow, which is right there, and which is right here. So medial and lateral epicondyle, olecranon process is here. So we'll get started now with the incision, and the first thing we're going to do is the green scalpel. We're going to just indicate where that incision will be. And so in the surgical procedure, we'll be starting 8 centimeters distal to the olecranon process, but we're going to start a little bit higher. Fixed tissue is harder to manipulate and go through, and so we'll need a slightly bigger incision. And so the incision will come down like that and then around the olecranon. And so when you're making an incision using a sharp instrument doing sharp dissection, the most important rule is not to be cutting down into things that you can't see. And so as we're making this incision, skin incision with the scalpel, we'll want to be visualizing what we've got right underneath it. And so Alex, what layer is right beneath the skin?
We have the superficial fascia.
The superficial fascia, the subcutaneous loose connective tissue. And the structures that we'll find in that are the cutaneous nerves and the superficial veins. So below that, we'll find the deep fascia, and that will surround the major muscle groups. The deep fascia of the limbs organizes the muscles into groups which share a function, an innervation, and a blood supply. So it will be skin, then subcutaneous tissue, then the deep fascia. We'll open it and we'll find the muscle. So let's get started. And so if each of us had a clamp, thank you.
A little bit lower.
Okay. All right. Beautiful. That's it. We're going to have to reposition a little bit.
Okay.
See olecranon. Okay. And now I think you're going to have to use your fingers here. Oops. Jeez. Okay. And so if you pull on this side, I'll pull on this side.
Position.
It's a little shallow. So as we go down, we're just moving our fingers so we can actually see as we go. So it's a little shallow here, but better to be too shallow than
Too deep.
too deep. So when you come through the dermis, you can actually sort of feel it give, and that's when you should be stopping. All right.
Perfect. So we have a skin incision.
We have a skin incision. And now we're going to be using the Metzenbaum scissor and our clamps. And we're going to be placing the clamps along the skin. In pairs like this, and then reflecting the tissue. And thank you. And then the incision that we made was a sharp incision using sharp dissection. What we're going to be doing now is exploring for depth. And so we're trying to find that plane, and a plane is the intersection between two tissue types, that plane between the deep fascia and the subcutaneous tissue. So for that, we'll be using our clamp and our mesogyl scissors. And you can do it too. I think that's where we want to be. So there's the deep fascia there. So we have to go through this entire thickness to get down to it.